thank you and welcome. I'm Dr. Rudy Cashman. I'm a physician, neurosurgeon. I've been practicing neurosurgery in Fort Wayne, Indiana, about 36 years. I did another 2 years for the Navy and the Marines during the Vietnam War. So I've been around a while. During this time, I've learned a few things. This is what I'm trying to share with you tonight, to try to tell you about the problems that I've seen over the years. And the one thing I've discovered, that a good half of the patients, maybe as high as 90% for some physicians, have a medical problem that their own body, frankly, could heal. They don't need heroic intervention. They don't need big medicines, no narcotics, no operations. But I've been seeing that some of these people, in my experience today with this modern technology, have been over-treated. And I feel there's too many MRIs being done on some of these patients, too many injections, too many narcotics. So I've sort of developed an interest in what I call the mind-body-spirit connection. I think there's a mind-body-spirit disconnection going on in this country. It applies to all medical illnesses. It is not just in the back, which I'm a specialist in, the brain and the back. It applies to the heart. It applies to the abdomen. The majority of the patients that I see, you can teach them meditation, yoga instruction, relaxation techniques, and they can get better without necessarily starting some heroic medical workup. Let me tell you a little bit the difference between disease and illness. A disease is like lung cancer, diabetes. An illness is perceived sickness. In other words, you have symptoms, you go to the doctor, but in reality, there's no physical basis for it. There may be a chemical basis, but there's no physical basis. You can't get an X-ray and demonstrate what this condition is. But the condition bothers the patient a great deal. It may be disabling. He may be applying for Social Security disability. He may have a terrible pain problem. May have terrible abdominal cramps, terrible chest pain. So that is an illness versus a disease where you might find a brain tumor or a lung tumor. And this definition, I think, will become more important as we go on. I would like for you to, when you listen to what I'm going to speak, it's totally different than most physicians, I think, with looking conditions. So I want you to keep an open mind. But I don't want to be so open that your brain runs out. Okay? I want you to be critical because there's a different point of view. Mind-body syndromes, I mean, what are they? These are illnesses that are perceived by the patient to be totally real. But they're based on subconscious tension, subconscious anger. What are some of the diseases? Skin diseases actually are the most common. Eczema, rashes, itching. I can name about 10 different skin diseases that really had the basis on stress problems. Cardiac arrhythmia, cardiac problems, very common. For example, when I was in med school, next day we're going to get the finals. You know, my whole career, my life is dependent on these tests. And I tell you, I literally felt my heart would stop. It must have been beating 3 times a minute. I mean, I wonder when the next beat was going to occur. So that's what stress can do to you. In this article that I even read today to confirm my thoughts in this national magazine, they were mentioning that 50% of patients who go to a doctor with chest pain is psychologically based. But what you're seeing in society today, they're often running immediately. Instead of taking a good personal history, I think the most valuable physician is a physician today who takes a good personal history, a psychological history, not very often running with MRI scans and catheters and injections. A good personal history to make an accurate diagnosis. The physician that can tell the difference between a mind-body syndrome and a true disease is the most valuable physician in the country today as far as I'm concerned. I personally feel not many healthcare providers can take this proper history.